Welcome back. If you're just joining us, I'm Keith Friedenberg, Chief Operating and Innovation Officer at CHIME, and it's my pleasure to welcome you to the CHIME Innovation Virtual Summit. This program is made possible with the tremendous support of our sponsors, Avasure, Microsoft, and Nordic, and we want to thank them for their generosity. I'm delighted to introduce our next session and our panelists for this upcoming session titled AI, Not the Only Path to Innovation. We have Dr. Engers Fernandez joining us. He's Vice President for Innovation at Ocean. Jason Griffin is Managing Director, Digital Health Strategy and Cyber Practice with Nordic Consulting. And Laura Kriowski is the Rural Health Program Lead with Microsoft Tech for Social Impact. In this session, we're going to focus on the numerous other paths to innovation in patient care services and business operations not named AI, although we may also talk a little bit about AI. We've got a great panel of experienced leaders with us, and I know they're eager to get this conversation started. So let's go ahead and jump right in. Laura, Dr. Fernandez, and Jason has not been able to join us yet, but we're hopeful that he can join us. So Laura, Dr. Fernandez, welcome, and thank you for joining us here today.
Yeah, thank you, Keith. It's a pleasure.
All right.
Only a pleasure.
It's great to have you. Our time is short, and we want Jason to join us, and I know the team behind the scenes is working to get him on here, but we are time constrained. So if it's okay with you, we're just going to jump right in.
That works for me. Yes.
Okay. All right. Excellent. Well, I said we're going to talk about innovation that's not related to AI, but we're also going to talk a little bit about AI. We've been doing that for the past hour plus, and listen, the two biggest topics out there in the healthcare industry are probably AI and cybersecurity. We know there's an abundance of hype and hope around AI, as well as many ethical and governance and bias and transparency related issues. So we've talked about those just in the last session. As you all work for very different organizations and unique care delivery organizations, how are you seeing this playing out within your ecosystem? Is there more hype or more hope? Which are you seeing? Dr. Fernandez, let's start with you. More hype or more hope?
Well, I think, and I've been thinking a lot about this, and I will give my answer in the shortest amount of time, because there are two drivers, right? That is increasing the hype and the hope. The main driver has been end users. Just recently, I think April or May, Microsoft Workforce Trend report shows that 75% of knowledge workers are utilizing what is called bring your own AI to work.
Ooh,
so that
terrifies digital health leaders.
That's shadow AI at its best, right? And regardless of the generation, obviously Gen Z's is really high, about 86-89%, but
Wow.
also boomers is about 65%. So everyone is using it in the middle. Now, we acknowledge this really early at Ocean, and what we did was making sure that every single Oceanites, we call our staff Oceanites, was aware that we know this is happening. And as it's happening, we provided guidance on how, if you do it, this is the way to do it. De-identify any information regardless to the business that speak directly to the business, and we gave each one of them like how to use it. Provide prompts, because anyway, if they're using it, they use it right. Let's get what we're supposed to. So provide a few prompts and prompt classes, and then teaching AI as a whole, right? Because generative AI is not the only AI. It's the one creating the hype, but it's not the only one existing in the market.
Exactly.
And then from the other side, organizational side, and I go really fast, this is what we did. Number one, make sure all your executives are in line and design a set of AI principles on how it will be implemented. Number two, there are different frameworks, and I know Laura definitely is going to talk about train and share everything that they're doing, so I'm not going to talk about that. But the one that we decided to do was FAVES, and FAV as in Victor ES, for those that want to check it. Then with that framework, we design, we call it Radar, which is an assessment tool for each one of those AI tools that are coming in, especially generative AI, that is mapped against our framework and against our principles, and then design an inventory That now we're seeing as the federal regulations are coming out and state regulation that was the right path because we can track back why we decided to implement which tool and how. So that's what we have done. And Laura, I'm going to pass it to you because I don't want to take over that conversation.
Thanks very
Yeah.
much. Laura, what are your thoughts?
Well, as you know, Keith, I recently joined Microsoft as the leader for the Rural Health Program as part of Microsoft Tech for Social Impact. And I have to tell you, it has been such a learning and such an exciting experience because Microsoft clearly is invested very heavily in this. They really see this as sort of the next generation, if you will, of digital innovation is AI. Everyone from the CIO down, and the CEO down, and if you follow the news in the Wall Street Journal and the New York Times and things, you clearly see that that's the direction organizationally we're headed. We also understand we have an immense responsibility here as one of the leaders. And so at Microsoft, we have a whole team dedicated to responsible AI. Even within the team I work for, the Technology for Social Impact, the Tech for Social Impact team, we have a team called AI for Good. We have a responsible AI champ that is, as we deploy new Gen AI solutions out to the market, it has to be vetted by that individual. And as Engers mentioned, Microsoft is very involved in TRAIN, which is the ethical AI initiative across healthcare with about 40 marquee organizations participating, and to really set that framework about not only how do you define ethical AI, how do you operationalize it?
Yeah.
So I would say from our organizational standpoint, there's a lot of hope and a lot of hype. I'll also then just real quickly say at the rural hospital level where I'm operating and working really hands-on with these organizations, I think there's, they're watching and waiting, and they're also at the same time wading, WAIDING, into this space. So I think we're going to see a large uptick in that space.
Yeah, thanks very much for that. In my role at CHIME, I have an opportunity to speak with CHIME members and digital health leaders on a daily basis. It's okay, by the way, to not be at the forefront of the AI bleeding edge today, right?
Yes.
In fact, a lot of organizations are being very thoughtful about the fact that they're letting others go first, right? And they're learning. We'll be a fast follower if that's what we have to do. Be fine. And a lot of that is resource driven. Laura, I know this program isn't about cybersecurity, but I'd be remiss if I didn't note the work that you are supporting behind the scenes that's related to Microsoft support of rural hospitals and healthcare organizations and providing them with some of the tools they desperately need to fight back on this cybersecurity arms race. So I just want to mention that. Thank you for that work that you're doing. Again, it's completely unrelated to AI in this topic today, but I just wanted to say thank you for that work.
You're so welcome. It is an honor to serve those hospitals. I'll tell you what, right? To bring something that's so badly needed and give them the resources and the tools to help fight data breaches. So thank you, Keith.
Yeah. I speak with rural healthcare leaders all the time, and oftentimes what they tell me is, Keith, I'd love to be in this AI game. I don't have the resources for it. Every resource I have is aimed at cybersecurity and protecting my organization. It's AI is a nice to have. It's not a need to have. So anyway, applaud that work. Dr. Fernandez, back to you. AI is coming at us from everywhere. Laura mentioned CEOs, and so this is what people like you are seeing, right? The CEO seems the cool tech. The CFO, the CMO, the CNO, it's coming at you from everywhere. Are you seeing that AI is starting to suck up resources and support away from non-AI related technology platforms, implementations, projects, initiatives, et cetera? Is it pulling resources away?
Well, in our experience at Ocean being a nonprofit, we are very protective of the resources that we have available. So one of the challenges actually for me has been, hey, can I get a little more resources here in this side that is creating a lot of noise? our business model is basically providing services to our members, and the members themselves, they are asking, because with the hype, it comes just the marketing side, just saying this is gonna decrease the burnout of your providers by 15%. We CEO doesn't want to do that, right? In this time and age. But in order to do it in a safety manner, we need to bring resources that have the ability to understand the technology, assess the technology, and do all those processes that I was talking about earlier. So yes, it's eating up, but I think one of the things, especially in the nonprofit FQAC rural health perspective, there is a an understanding of yes, we will introduce the technology because it is helpful, but we will do it in a very responsible manner. So that's one. The second piece is the skill set is not there yet.
Yeah.
So inspiring internally staff to get better at the skill set is one thing that we have put as priority. I have leveraged a lot of the documentation that Microsoft has designed, because Microsoft has put a lot of tools out there to make sure that if the technology will be used in a trustworthy and ethical manner. Now, it's bringing a lot of fights internally, and when I mean fights, not actual physical fights, right? It's just where our attention should go. But we have a lot of fundamentals needs that haven't been solved from before generative AI come and make that noise, that we have to put a lot of intention. So how we have going to prioritize that, I think that's a piece of information will be helpful, is assimilating tools one step at a time. Not tools, features one step at a time. We have been putting a lot of energy in those that will be impacting providers burnout, and those that will enhance somehow patient access. Those are focus number one, which is in line with our mission and what we're trying to do. So, and the guidelines for that prioritization comes from those set of principles that I spoke in the beginning.
Yeah.
That although in the beginning might seem like, oh, you know, it might be a waste of time to not negotiate those, because they become the path on what will come in and out.
Yeah, sort of your non-negotiable tenets. Laura, I want to move to you for this next question. We heard in the last session from Shiro Goswami. He said, Keith, look, AI didn't start on Thanksgiving Day 2022. Okay, maybe the Gen AI started, but AI has been around for decades, right? That being said, Laura, how do we strike the right balance in terms of advancing AI while also continuing to focus on human-driven and innovation across the healthcare enterprise? Because at the end of the day, there's technology, there's people in process, and it's easy to get caught up in the hype of AI and forget about what's actually behind all of this, which are people, humans. So how do we balance that?
Yeah, Keith, excellent question. And I think this is one we all have to be immensely attuned to. When Engers and I were preparing for this, he said something that really has resonated with me. And he really said, all innovation is not technology, all technology is not innovation, right? And I think we need to keep that in mind. What I think is really essential here is that we listen. We listen to the voice of the customer, and listen, what are the constituents telling us within the organizations? What are their pain points? What are their suggestions? At the end of the day, that's where the source of innovation can and should come from. And so, while some of that can be enhanced or enabled by AI, it's really, organizational specific, and comes down to listening and responding. Now, we can't meet everybody's needs, and we can't meet everybody's needs with AI. But at the end of the day, if we're not focusing on what's driven by the stakeholders inside and outside the environment, we're going to lose sight of the fundamentals here.
Yeah, thanks, Laura. Dr. Fernandez, thoughts on that? How do we continue to strike that balance, advancing AI, but also realizing that at the end of the day, people are really in the middle of all of this?
Laura and I have a lot of conversations, so I'm glad that we get to be here at the same time. And among those conversations, also one thing that my role is vice president of innovation. So most people look at innovation and think everything that is cool, everything that is coming forward, so on and so forth, right? But it's totally a little more conservative than that. And I will be the first one probably fighting what I'm about to say, but it's true. This is the pragmatic truth. Is that the way I tend to look at innovation is thinking 5 years from today, 3 years from today, 10 years from today, what it will be constant. What are the needs that with consistency we know we need to meet? In our cases, there's always going to be a patient with a need to see a doctor, and there will be a provider. That's the center. That's the cell of the entire healthcare system. When we look at from that perspective, there are many needs that not yet has been met, especially in the EHR world, right? Like the promise, probably some people have forgotten when EHR came to our world, the promises were very high, and there was a lot of hype. And now we're dealing still 20 years later with many of those challenges. So the right balance will be, to answer the question directly, is make sure that you understand what is going to be constant in your, not just in the industry, but in your organization, and then put the energy there. There is a really good thing though with generative AI, that because of the capacity of this godlike type of technology, it can enhance many of those fundamental needs. But there are many this generative AI as in moving from just moving from large language model to a smaller model that are more specific into the needs. I think that both things can be managed as long as you have someone that understand the technology and understand the need of the organization and where the organization is going.
Yeah. We're both innovators, so I'll share a quick story with you from a good friend of mine, an amazing innovator, Todd Dunn. He shared with me once at a CHIME program. He said, Keith, you have to recognize when we talk about innovation, most people think we're building rocket ships.
Yes.
Okay? The rocket ships that go to the moon. The
Oh, I
reality
love
is
that.
it's never that sexy, right?
Yes.
It's really more about often improving workflows and efficiencies. It's the constants and how do we do it better, cheaper, faster, higher quality, etc. It's not flashy. It's not
Yes.
always the
No.
funnest innovation, right? It's not building rocket ships, but it's important nonetheless. Um, so we've talked a lot today about AI, and I'll say this: not everything is puppies and sunshine. There are real concerns. There are concerns about transparency and ethical concerns, and how do we adopt and embrace it responsibly. So how do we now strike that balance between innovation and caution, ensuring that if we're adopting, utilizing AI or even non-AI technologies, that we're using those tools to enhance patient care without compromising ethical standards and being responsible about what we're doing? How do we strike that balance between innovation and caution? Laura, do you want to start first?
Yeah, I mean, I think there's a couple levels. One is at the global sort of industry level, and then one is just more tactical in the organization. And I'll share an example of an initiative we're working on that I think really addresses that latter scenario. Most of the industry is familiar with CHI, which is really CHAI, which is really working to set some basic guiding principles, rules of the road, right, and for the healthcare industry. And then its counterpart is TRAIN, which I mentioned earlier, and it's a coalition of about 40 healthcare organizations, and actually has been really embraced overseas and internationally. And I could see this really gaining momentum. But their role is, how do we operationalize this,
Mm-hmm.
right? And how do you do it in a way that strikes speed to value and that caution and that prudence, pragmatism you talked about, Keith? So I think that's where we need to work as an industry together towards that sort of, it's not going to be perfect. It's not going to be right for everybody, but if we can start coalescing and learning and sharing, I think there's a lot of value in that. I also think it needs to happen at the organizational level. And I think this is a little bit of a challenge, and I'm glad you, Keith, mentioned the rocket ship example, because so much of our work is not building rocket ships. It's like moving piles of dirt around every day. And just know that it gets a little better every time you move the pile of dirt.
I'll clap to that also. Yes, moving piles of dirt.
Yeah. And, we've talked a little bit about this, and Angers and I, we do chat a lot. And I think one of the areas that will benefit so much from innovation and AI, Gen AI driven innovation is the FQHC and the rural health space.
Yeah.
So we have to do all we can to promote and enable adoption. And one of the initiatives Angers and I and a handful of rural hospitals are involved in is a program that we launched in parallel with all of our cyber work around generative AI for hospitals. And it was this for rural hospitals. Again, this concept of let's bring some stakeholders together and listen to what their pain points are and come up with a lightweight, no code Gen AI tool that solves one of their unique struggles. And so we did this. We had a workshop. We had 2 days. We talked about AI. We talked about, the fears and concerns it brings to the organization. And then we started talking about use cases. And what we did after we defined our use case, we actually took those 5 hospitals and those CIOs and their revenue cycle leaders through a development process of about 6 to 8 weeks. And we showed them how algorithms got created. We showed them, we got their input on the algorithms and the validity, and now they're doing the testing. And, you can't do this for every hospital with every AI product, but what we did is we broke through that barrier of understanding. We went from, the robot's going to take my job to this is really cool, and here's its strengths and limitations. So I think it's tremendous education that needs to happen.
Yeah, you remove the fear, right? You remove the fear about the technology. Dr. Fernandez, your thoughts?
Yes, I know we're short of time, so everything she said is right on point. And then the only piece I'm gonna build upon is the ethic view is for humans. The tool is doing exactly what it's supposed to do. It's doing it. And we need to understand they're just gonna get better at it.
Yeah.
Now, from our side, from the ethical point of view, that is from the human side, it is understanding. And since this is forum is for innovative executive, I make a call out to you. Make sure that your CEO, that your COO, that your CFO, they have even the fundamental understanding of what the technology is, where the limitations are, and where the power is. You as a CIO, CTO understand it's not going to be enough. One, I keep saying, I tell this to Laura a lot. One is too small to create a real impact. So it's not going to be just one organization. It's not going to be just one industry or one nation. It has to be global and understanding global from the ethical standpoint on how we move forward. So bottom line, everything she has said, but build on top that the education is not just for the staff that are using it on a daily basis. Our decision-making process, it has to be also really well educated and not spending the time today to understand the impact that these innovations are going to bring in, not just in our industry, but the communities that we serve. I'm going to put it in a more basic way. We cannot treat this type of technology the same way we implemented previous technology. That's not going to play out. We need a new playbook, and that playbook is being in the making right now. So we need to come together. This is one of the greatest things that I see CHI is doing, Train is doing, REL is doing, the program that Laura was just mentioning. But we need more. We don't need less. We need more education that is not limited just for those that are technology fans or technology driven in our education.
Yeah, Dr. Fernandez, you just touched on the core philosophy that Aaron Murray shared when he kicked off his opening keynote, which is what worked before will not work now.
Yes.
It doesn't work in this accelerated AI healthcare environment in the journey that we're on now. And you're right. There's no playbook for all of this. We're writing it now, right? It's the playbook is being written now. And if you look at how things are accelerating just from March of this year, 90 days later, right? We're talking about AI in ways we didn't even consider 90 days ago, right?
Yes,
So
that's true.
old rules will not work for a new game is
Yes.
absolutely what we're talking about. The two of you have really emphasized the need for education or educating users, um, as well as transparency, right? To build trust and build confidence, reduce fear. Are there other practical strategies that you could share with others who are with us here today, listening in, that you're using at your own organization again to improve trust and confidence, reduce that fear?
Yeah,
Laura?
Keith, I have a couple ideas, both based on my work at Microsoft and also in previous roles. And really, I think importantly, in the work I've done in the safety net with FQHCs and community service providers, is that organizationally and even as an industry, we need to think not just about clinical applications, which are profound, that they're very complicated, right? And they touch on a lot of ethical things. There's a lot that can be solved at the business level, at the care management, transfers of care with AI. And I think when we think about an ecosystem of care being healthcare, community, social services, organizationally leaning into that. I think that's the first part. I think the second thing is, right, AI is the it right now. It's the it thing.
Yes.
But as the title of this session implies, let's not lose sight of why we're here and who are the real experts in the room in terms of innovation. And so often that's that frontline staff, and listening and tuning in and supporting them.
Well said.
Yeah. I just going to add to what Laura said. We The number one practice that is important besides getting educated is understanding that many of the drivers, especially in the healthcare field, uh, that will be impactful are not coming directly from the healthcare field itself, from the processes that we have in place. They're coming from uh, parallel sites, uh, folks trying different tools and then bringing to their own. One of my biggest fear, honestly, but also it is one that I'm really excited about, is that this technology are coming together is increasing and facilitating the access and understanding of care to the patient itself. But that makes them also very vulnerable.
Yeah.
And our standard of practice will not work in 3 years, 5 years from today, because the models that are coming out and that they're playing on their phone and they're looking at it. I have a headache. I cannot see my doctor. Probably the next appointment is just in 2 months. I need to have something today that will clarify that to me. Where they're going to go to that gadlight technology that they think is the solution for everything. So we have to look outside of uh,
Yeah.
the the framework that we have to design for ourselves and get connected, not just with the front, but the real client for healthcare, which is the patient.
Yeah.
We have to get
Absolutely.
closer to that area than we are today.
You're going to spin me up, and I'd love to spend another hour with you talking about consumerism and patient access. And, but we're quickly running out of time. I'm sorry to say we've got about a minute left. Um, I think it's safe to say the three of us are bullish on innovation in health and care today. And I think the opportunity for AI and even non-AI tools to support and augment that innovation. Looking out a little over the horizon, what significant innovation in healthcare delivery do you see the next 1 to 3 years? Understanding that 1 year seems so far out right now, but the way things are accelerating, 1 to 3 years, what do you see? What's your vision for the future here?
Laura, I'll go first because I tend to talk a lot, so I want to make sure your voice is in.
Yep, no, I'll just be quick. I think we're working our way through the honeymoon stage here, right? And it's kind of happening at warp speed as we've talked about. for me, what I think is really most intriguing and what I think is most valuable, and where we're going to hopefully see, you know, a lot of innovation and change is what I mentioned earlier, is that using technology, using innovation in many forms to bridge and bind health, social services, substance abuse, behavioral health, these historically disparate silos that are literally, you know, killing our many individuals and hurting communities, using innovation to improve the care of those individuals and those communities.
Thanks very much, Laura. Dr.
Uh,
Fernandez, 30 seconds or less,
30,
your
30
vision for the
second,
future.
30 seconds or less. This large model, they're going to become smaller, very driven in a specialty. We're going to start seeing agents coming this at the end of this year, beginning of 2025. And if you combine those trends with our push of value-based care, here's a term that I'm start reading now, is results as a service. Value-based care is going to turn to results as a service for patients, for providers, and organization. I can see you already, Reed, saying that's going to be a tough one, but I think that's the path where all the trends are marked. That's kind of the path that we're seeing flag. If you want to go 5 years from today, my prediction is that brace yourself with this concept of agents. I can see providers managing different type of bots that are patient facing, and that decreasing hopefully the burnout, but also increasing access to patient from a source of information that is reliable.
Thank you. On that note, I want to thank you both, Dr. Engers Fernandez, Laura Kriowski. You've both been a lot of fun. Thank you for joining us today. I wish we had more time, but unfortunately we are out of time. I want to thank Microsoft and Nordic for supporting this particular session. We're sorry Jason Griffin wasn't able to join us. Jason, we hope everything's okay. You're doing well.